If you don't tell us what you need to come into the office for, it makes it difficult for us to be able to schedule you for the right appointment. That's right. The first mistake that people make when scheduling their doctor's office appointments is not actually telling the front desk staff or the person who's making the appointment exactly what you're coming in for. Honestly, it might sound surprising, but it's actually not enough to say, "Oh, I'm coming in to follow up," or I just need a routine follow-up visit." You really should tell whoever's scheduling the appointment exactly what you need to come in for, and that may mean also some things that might be a little personal seeming, but trust me, it's not personal to us. So look, if you've been having chest pain, tell us, "I've been having chest pains. I want to see someone about this." If you've been having issues down there, if you have a urinary tract infection, if you need a sports physical done, if you have paperwork for your insurance company that needs to be filled out, if you've been recently discharged from the hospital and you need to follow up, tell us exactly what you need an appointment for. The reason why is not because we want to be all in your business. Of course, as a doctor, I'm going to be in your business, right? But it's not that the front desk staff or the scheduler needs or wants to be in your business, but it helps tell them how long your appointment should be and where that appointment should be during the day, during the week, etc., and what's possible. So, for example, if you're coming in for a physical, well, typically, offices give more time for physicals than they do follow-ups. So if you say, "I'm just here to follow up," but you think you're going in for a physical, your doctor may not actually be able to perform that day because they may not be allotted that time. Same thing as if you're coming in for chest pains. If you tell us, we can get that EKG machine ready to do the EKG right when you step into the office. Same thing with the urinary tract infection. Don't wait till you get in. Tell the staff what you're there for so they can start preparing. Guys, telling us what you're coming in for not only helps us get ready for you in the office, but it also helps our staff schedule you appropriately for the right period of time. The next mistake that people make when they are scheduling doctor's office visits is not scheduling the right appointment. And if it sounds similar to what I just said, it's actually quite different. So please understand that physical appointments, let's say you're coming in for a routine physical, that's actually a very different appointment than a follow-up visit or a visit for a particular problem that you're having. That's right. So let me give you an example. As a family doctor, I see patients all the time, and I'll tell you something that commonly happens is people will schedule a physical appointment to come in for their yearly physical, but they'll also come in with a list of concerns that they have as well. It might be back pain, it might be foot pain, it might be a rash, it might be depression, it might be whatever the case may be. And I understand because many patients say, "Well, I knew I was coming in for my physical, so I thought I would just bring these things up too." The problem with that is we generally don't have time to be able to do that. And typically, how we schedule the office visit is generally what dictates what we do. So if you're scheduling a physical appointment, the things we do during a physical is, of course, we take care of any paperwork that you need done, but we might do your vision and your hearing. We'll do a physical exam. We'll go through your preventative care, mammograms, pap smears, colonoscopies, all that kind of stuff. And all of that stuff, by the way, takes a decent amount of time. That is a visit in and of itself. And there's often not room to then add on other complaints that deserve time in and of themselves, like back pain, neck pain, rashes, depression, whatever the case may be. So when you're going to schedule your office visit, think about what it is that you need to be seen for and understand that a physical, a yearly physical or what have you, is very different than, say, a problem visit or a follow-up. A physical, we're doing preventative things. We're doing, okay, let's check your height and your weight and your this and that and go over, counseling things and prevention stuff. That's not usually dealing with problems, okay? And likewise, if you're coming in for problems or certain complaints and things like that, we may or may not be able to throw in preventative care items as well. And once again, the reason is not that we don't want to, it's just that we don't always have enough time to do them, and they deserve the right amount of time. You deserve the right amount of time for all of those issues to be addressed appropriately. So please understand the difference between a physical and a problem visit. Think about why you want to come in, and that's also why you want to tell the scheduling person, as I mentioned. They will help you determine if your visit should be a physical or if it should be a problem visit or a follow-up, okay? All right, next mistake that people make when they are scheduling their doctor's office appointments is not seeing other providers in the office when necessary. This is something I run into quite a bit. I know my colleagues do. I have patients I've seen for over 10 years. But this is the thing. I'm not always in the office. And the same thing happens with my colleagues as well. Now, let's say if you're a patient of mine and you have a complaint or something that's going on that really is quite urgent, that I don't want you to wait to be seen for. It's going to be important for you then to make sure you are seen, but understand it may not be by me or whoever your normal doctor is, and know that that's okay. The most important thing is your health. So when it comes to things that are particularly urgent, please don't be upset or offended if you have to see another doctor, especially if it's last minute. The most important thing is that you see someone, you see a healthcare provider to get the issue taken care of. We don't want you to be sick. So see whomever you need to within the office or in the environment to get your acute complaints taken care of. Of course, then you can go back to your usual doctor. You'll fill them in. They'll probably know anyway. But understand that we expect that might happen sometimes, and it's okay. All right, the fourth thing has to do with yearly physicals. The fourth mistake people make is they don't schedule yearly physicals. That's right. I recently saw a patient not too long ago, and I looked back in her chart and realized for the last 4 years she'd been coming in for follow-up visits, never having scheduled a physical. So what that meant was her preventive care was a little helter-skelter. Sometimes if physical visits are not scheduled, it could put you at risk for missing or not being prescribed your normal mammogram, colonoscopy, pap smear, immunizations, and things that you need. So make sure that when you see the doctor, you're not just always and only seeing them when you're sick. If you do, I can pretty much guarantee that you're going to miss out on some preventative screenings that you need, and some things that we need to be going over with you. So make sure that one visit a year is that physical appointment, that health maintenance exam, that preventative care exam, the physical, which once again is generally a longer period of time that we get to spend with you in the office than follow-up visits, or say problem visits as we often call them. And the last thing I would say, the fifth mistake that people often make when scheduling office appointments, is basically not asking the front desk staff or the scheduling staff questions or things that you don't know the answer to or you need assistance with, especially when it comes to scheduling. I don't expect you to be an expert at knowing how to ask for doctor's appointments and what you need to ask for. You may not know, hey, what should I be coming in for? Well, I know I got this and I got this and I got this. What should I schedule, or how should I express this? That's okay. It's not your job. It's our job. So, if you have questions about how you should be scheduling your appointment, when you should schedule appointments, if your yearly physical is due, by the way, because you can't get that too early in the year, right, for insurance purposes, all of that good stuff, please ask the front desk staff or the scheduler. We're here, well, I guess it's not me, but I say we collectively are here to help you and to make sure that you get what you need, and that your appointments are appropriate so that your doctor can see you and it's a productive, fabulous visit. And I would also say too, and this goes both ways. When you're talking to front desk staff, when you're talking to office managers, to people who are the staff in offices, please be kind. I can tell you that I have worked with, I love my office staff. They are literally the best in the world. I have worked with office staff my entire career that has been amazing, and I thank God for them every single day. And I know that we want more than anything to help you. I know that sometimes things are hard when we're sick though and we don't feel well. Try to be as kind as you can to the office staff. They're trying to help. And by the way, if they're not being helpful, make sure you let someone know. But also try to be kind to them as well, because, well, honestly, they will tell us. And I just say that as a sign of mutual respect. This also goes for doctors, guys. The weight of responsibility for kindness does not just rely on the patient. It relies on the doctor too. We should be kind to you as well. The office staff should be kind to you as well. And we hope that you're kind to us. So it's just a friendly reminder that we can all spread a little love as much as we can. Guys, I hope this is helpful. I'm Dr. Jen Caudle. I'm a practicing family physician and on-air health expert and video creator. I do daily videos. I will see you soon.